Well, good evening, everyone. This is Dr. Ellithorpe with Tustin Longevity Center here in Southern California. And we're doing our Tuesday night, 6 o'clock weekly Ask the Doctor Anything, where we take our email questions about general health questions. We do this for educational, informational purposes. We're not doing this for specific individual advice. We take your questions, and then we have the chat here on the YouTube in which you can type in a question in the live area. And it also looks like this time we're not having any chopping of the sound like we did last week. So that's good. All right. So we have people piling in right now. And once again, if you're on tlcdoctors.com, you can join our newsletter, get on our email list, and then you'll get notification of these channels coming up weekly and others that we'll be announcing sooner. If this is a value to you and you're benefited from this, please share and hit the like button. That will help us and get more people involved. We had a wonderful grand rounds today. We had the entire staff at TLC. We do this once a month on the second Tuesday of every month. All of our physicians, we had 8 here. 2 were on Zoom, but we had 8 healthcare providers. We had all our nurses and our phlebotomists and our medical assistants and our front office staff and management team. And we talked about functional medicine and how are we doing as a clinic serving our community. We do this once a month. We started a new electronic medical record, and so we're trying to address the flow and dynamics of everything we do to help with the care of our patients. As physicians and a team here, we discussed current issues on providing preventative health care and how we're going about that, our immune drips and so forth, and all the various aspects of billing and so forth. So we are working very hard to make functional available medicine to you and to your family and friends. So please like and subscribe and share this with a family and friend. We'll begin today since I don't see any live questions yet. We'll start with Debbie on the email question. She says, are there some more natural remedies to help with shingles? A friend in her 70s has been suffering for weeks. She has not had any COVID shots and is on some kind of medicines prescribed by her general practitioner, but they're not helping. Well, shingles is an outbreak of a dormant varicella virus that once you get chicken pox, it lives forever in the spinal column and the dorsal horns of your spine. And as we age, our immune system begins to decline. Our T cell, white blood cell leukocytes start to act more slowly. If you're on the standard American diet, your high carb, starchy, fruit sugar, sugary drinks, too many beans, rice, pasta, bagel, chips, nuts, seeds, too many of these things, plant foods can become excessive carbohydrates, starches, and fruit sugars, and they all suppress your immune system. So with so much marketing to eat this stuff, and with aging, we lose our muscle mass, and with the muscle mass loss, our engines for burning down what we had been more typically consuming in the past, we start to lose the muscle engine to burn it, and we're still eating the same amount of carbs, and there's an offset. And then what happens then, your sugar starts to climb as your muscles recede, and you become more inactive with aging. And that's one of the ways we see the elderly move toward diabetes as they age. So when I'm done with this program today, I will go immediately to the gym, and I'll be doing my heavy weightlifting workout with my husband and my aerobics. And I got my two new rescue dogs that I have to walk every day, and they're a big challenge for me to take out. And one's a big 50-pound dog, and the other's around a 25-pound dog. Beautiful animals. Still trying to train them. And so you got to stay active if you're going to help build your immune system. So building your muscles, being low carb, will help your immune system. So that's the number one thing. Now, we all tend to not drink enough water as we age. And so we always have our water. I use a straw because I drink more water with each gulp if I use a straw. It just makes it more interesting, and it's a reminder to me. But you have to drink enough water because the capillaries are getting clogged up, and the sugars and the antigen antibody from food allergy, leaky gut, and that clogs up our capillaries, which then makes debris build up, waste, which ruins and harms and wastes your immune system. So having enough water also is important. Then taking anti-inflammatory systemic enzymes. This helps reduce the clogging, and it'll be like little Pac-Man trying to get through those little blood vessels to help get white blood cells where they need to go. So zinc, taking zinc in the form of 25 to 50 milligrams and doing that daily will help your immune system with shingles. And then taking a high dose vitamin C immune drip, you can come in here or find a hydration center that will help with your vitamin C. Taking it orally, taking high dose vitamin D, especially at the onset of any viral illness or outbreak, whether it's shingles or herpes outbreak or anything. High dose vitamin C helps because that helps your T cell function immune system. Um, Another thing is quercetin, taking 800 milligrams a day, at least 600 milligrams. That helps as a ionophore, which allows for the penetration of a healthy cell membrane. See, this is a cell membrane in the picture here. So to get a healthy penetration, so zinc can get into the cell, and then that will help suppress the ribosomal reproduction of viral particles, and that helps as well. Using Argentine silver spray, that is a systemic silver nanoparticulate, so it's much better than colloidal silver, although colloidal silver is still good. But Argentine silver, I think over the counter it's called Sovereign silver, but it's half strength. We doctors only get the Argentine, which is the full strength. But if you spray this on the areas that are the outbreak, it prevents a secondary inflammation from bacterial overgrowth in these sites. And then fasting. Fasting stimulates the immune system. So if you're coming down with a cold or an outbreak of shingles or herpes, any viral illness, like last week, my grandchild, I think, gave me a little bit of a viral exposure. And by Tuesday night of last week, 1 week ago, right after I finished, Tuesdays are hard days for me because I work a long full day. Like I've been up since 5 working, at full speed, and then I see all my patients, and then we have our video here. And so I was run down a bit, and I think I started getting that sick taste in your mouth, when you get a cold. Uh, but I had started fasting because I fast the first week of every January, and that's a pattern. I try and not eat for 4 or 5 days, the beginning of January 1st through the 6th, and Labor Day, Monday, the whatever Labor Day is, 5 days later. And I do this to kind of cleanse from my exposure to more treats that I would have normally had. That fasting helped get me through without missing a day of work or skipping a beat in my life. I think I ate last Friday. So I took a vitamin C drip. I took the D50,000, one a day, high dose vitamin D for 5 days. Then I went back to my usual 15,000 a day. I took extra TLC multi-mineral, so I got a little more zinc in every day. Instead of 3, I took 5, I think. I took my D-Hist, my quercetin, my argentin, and I was able to get through that achy low back fatigue hitting you, the pasty taste and congestion. And I fasted and drank a lot of water, had the vitamin C drip, and then boom, the next day I was ready to go back to work. So that's a long answer, Debbie, but it helps explain how we here at Tustin Longevity Center stay so healthy so long and can work at our peak, even like me in my 70s. All right, Lisa, for a menopausal or post-menopausal woman, what is the best way to supplement testosterone if the blood work has said that I am low? I chose vaginal cream from my doctor over pellets, but didn't know if there was a better way. Well, Lisa, um, I try and not put it as much, I try and keep stuff out of the vaginal areas and let the normal physiology and discharge and cleansing of the vagina. So I don't like putting anything in there. What I would recommend for DHEA is DHEA, and I use it somewhere in the 25 to 50 milligram range for women. And DHEA is the precursor for testosterone for women and also for men. It helps your adrenals, your stress. That's also a good thing to take if you're stressed and you have an outbreak of shingles or a viral illness. So I take 50 milligrams myself every day. And that converts to testosterone in a woman. For me, it'll keep me from having a low testosterone in the 20s. And I think the last time I checked it, my testosterone was 170. And that's very good for my muscle and my weight training. So my suggestion is oral DHEA for testosterone supplementation. And yes, I know there are topical testosterones, but you can get so much more benefit if you take the precursor DHEA because it helps your adrenals, it helps your immune system, it helps your testosterone and muscles. So why would I use an end product, testosterone, when I can help a woman in many other ways just by giving her the oral DHEA? Okay, it looks like we're getting questions on the live chat now. Kimber says, question, do you prescribe Lugol's iodine in your practice often? Well, I use iodoral. It's a tablet form because the Lugol's can spill and stain things, but Lugol's is the old traditional way that we used to give iodine supplementation. So I'm in favor of Lugol's. It's just I haven't been doing it because it's so much more convenient to use a little tablet. I am low on iodine, and my provider is being very conservative. And after starting multivitamin with iodine, went even lower. Well, Lugol's, I see I haven't prescribed it in so many years. I forget the milligram strength per drop. But I think the standard Lugol dosing was somewhere in the realm of 6 milligrams. And the tablet that we have is a 12.5 milligram. And I've been using that for 25 years at least. And I really like the tablet. Simple, simple, simple. So women in Japan that have a natural dietary intake of a lot of seaweed and sea products get anywhere between 12.5 to 50 milligrams of iodine a day. So I don't think you have to be too worried and conservative. If your doctor's new in functional medicine, let them learn, let them grow and develop it. You can ask and say, I would like a dose that's higher, but make sure that you're getting your free T3, your thyroid levels measured, and your thyroid stimulating hormone and your thyroid antibodies tested. And you can do a urine 24-hour collection. And we do a provocative test where we give 50 milligrams of iodine, and then we collect urine for 24 hours. If your body, when you do the testing on the urine, if most of the iodine you took of the 50 milligram is peed out because it's water soluble, then your body did not need much supplemental iodine. That is extremely rare. I would say maybe 4 people in 20 years in my practice have had enough iodine in them already that when they urinated, they had close to higher 90 to, or higher percent peed out of the iodine they took on the challenge. 99% of them had too little. So, Kimber, tell your doctor to be not afraid to let you try this and get a test. Do a 24-hour urine collection. There's a book out there by David Brownstein from Michigan. He's a family practitioner, and he wrote the book called Iodine, and it explains it thoroughly there. So get the book for your doctor and bring it over, read it yourself, and we'll go from there. All right, so Talon is now saying audio is choppy. Jeff says the same here, audio is choppy. And then Talon said it's better now. Talon went on to say, I will leave and come back. Oh, I left and came back and then it was better. Okay, well, God is on our side. All right, so Lisa says, my question is, if someone has to get a PET scan or MRI, how damaging is the contrast, which is the gadolinium contrast material they inject you with? What should be done after to help rid the body of the stuff? Absolute good question, Elisa. Do EDTA chelation because it'll pull the gadolinium right out. And we do that all the time here. And we tell our patients that have to use contrast dyes, the gadolinium dye for these contrast scans, to come in afterwards the same day or the next day or as soon as they can get in and do a couple of chelation therapies to try and pull it out. I have an article in my hallway here I hand out to people about the neurotoxicity of gadolinium and all these scans. And most of the doctors out there don't know about heavy metal toxicity, let alone gadolinium. And so it is a growing knowledge span that you have to help your doctors learn about. So you can put in your screen. I usually find this better on bing.com, bing.com. Put in contrast scan gadolinium and neurotoxicity. And you'll see all the articles on this. All right, then. Okay, Jeff said I had to quit and then come back in as well. That's interesting. So Elisa said thank you. Okay, Kimberly Mountain says thanks. Okay, so let's go back to my email questions and ask. I am dry. There's so much teaching and talking today. A little bit of hot coffee, a little bit of water. All right. Lisa said, hello. If I take systemic enzymes, is it redundant to take glutathione and NAC and Juice Plus? Thank you for your input. No, because systemic enzymes are anti-inflammatory. They are proteolytic enzymes. And so if you get plaque or mucus buildup in a sinus infection, or you get an injury and you have a lot of scab and material bruising. I had really, the back of my hand, you can't even see it, but I hit the back of my hand real hard right about here. And I'm telling you, this was almost black with bruising. and that was last week on Tuesday or Wednesday. So I took the systemic enzymes 5 twice a day. I drank my fluid. I was fasting, and immediately I healed up. So enzymes break up all that junk that leaked out of my blood vessel, the little blood and the serum and proteins, immunoglobulins. And enzymes chew it up like little Pac-Man right through the capillaries and around the tissues and disinflame the human body. So that is totally different physiologically, in a sense, than if you take N-acetylcysteine, which is a precursor to what makes up glutathione. And glutathione is an antioxidant. It's very important in your metabolism, energy metabolism, TCA cycle, cyclic Krebs cycle. And N-acetylcysteine itself is an antioxidant as well. Juice Plus is a phytonutrient concentrate from vegetables, from fruit, and from berries. These phytonutrients can have many different classes in them. There can be anthocyanidins in there, pycnogenols in there, things like ascorbic acid. So these phytonutrients in Juice Plus are a boost to antioxidant nutrient requirements in our own physiology. So Juice Plus is in a category of its own, slowing down cell membrane damage. Remember, when there's a damage to the cell membrane, like right here, this is from a virus getting into it, or trauma, or a free radical oxygen species damaging it from hypoxia, or poor combustion of the mitochondria inside, producing a lot of free radical species. So there's many things that injure it. So if you have a shield, and that shield is the phytonutrient protection that can take the hits of free radical species, reactive oxygen species, and that's what Juice Plus does, you're going to have less injured cell membranes and be healthy like this. And your skin and your eyes and your corneas and your blood vessel walls, the endothelial lining, and many, many parts of your human body will live longer, last longer. So I've used Juice Plus for close to 30 years. I take N-acetylcysteine and glutathione, and I use systemic enzymes, and they're all valuable, and they all have a job. Just like, the body has many parts. Is the head more important than the foot? Well, you can't get around without feet. And so they're all important. So all these things are important. So hopefully, Alyssa, that answers your question. Mary goes on to say, at my recent eye exam, and after having the same prescription for years, I was told that my prescription had changed quite a bit, and now I have cataracts. Is there a natural way to rid my eyes of these cataracts? Thank you for your help, and God bless you and your day. Thank you, Mary. A cataract is a part of that lens, that glassy ball, you might say, in front of your pupil that expands and then contracts depending on the ciliary muscles, scrunching it up or pulling it out and thinning it out, so that it'll change the light rays going through your eye for near or distant viewing. And when that lens gets burnt or oxidized, the proteins coagulate and stick together, and that is pretty much irreversible. I would certainly suggest that if it's not bad, I would get the sugar out of my life. I would really drink plenty of water to hydrate it. I would do chelation therapy. I would do vitamin C IVs. Juice Plus, systemic enzymes, the multiminerals, walk, exercise regularly, and observe and see how you do. But once you've burnt or oxidized proteins, which are in the lens of your eyes, it's a scar, and that's what they call cataracts. Now, the best thing to do is to try and prevent that. But everything is a grade. So if it isn't that bad, I mean, I just saw my optometrist, Dr. Grant, here in town, and he looked at my eyes and he was just surprised to see how clean my lenses were. Or maybe he was being kind to me and didn't want to say anything, but he certainly didn't say anything was going on with my eyes. And I have to attribute this, and I praise God and the Lord for all these wonderful things that my father and very wise physicians and research scientists, PhDs, have done before me to get me to be aware of cell membrane structure physiology. So if you don't have a healthy cell membrane, you've got an injured cell, and that injured cell is going to crumple up and get sticky and die and create protein oxidized, gooey, sticky scars. So that's why the cheapest thing to do is drink enough water every day, as much as you can, half your weight in ounces, pounds as ounces every day of your life. The older you get, we are making less enzymes. So take supplemental enzymes on an empty stomach. Take the most researched nutraceutical in the world is Juice Plus for DNA damage prevention. I've never, ever seen a nutraceutical, to my knowledge, that has university-based, peer-reviewed literature showing less DNA damage within a month of using their nutraceutical, and that's Juice Plus. So you'll have less damage occurring, free radical damage like here, and that's been proven on Juice Plus. A couple of studies on that. So I do that, and I do chelation to get that circulation to the every part of my body. So you see, everything matters. You can't say one thing's more important than another. And you have to have a decent gut membrane to absorb these things. So, you have to have a doctor that tries to do it all. Now, talking about you have to eat the right structure to make this cell. So you can have the cleanest blood, but if you don't have phospholipids and protein that you're eating that make up the materials to repair the breaches in the cell membrane, what good have you done? So you can have a beautiful inside of the house, but if all your windows are broken out and you're not getting any new glass replacement, your house is open to birds and rats and coyotes coming in. All right, so let's see, are we getting new questions? Yes, we are. On the live chat, we have Rosa. Good morning, doctor. My mother is 97. Bravo. 97 years old. She has diverticulitis and is not eating well. She took antibiotics, doing better, but doesn't want to eat or drink. What do you recommend? I would give her or someone that has inflamed cell membranes in the gut. So all diverticulitis is these little outpouchings in the tube of your colon. These little outpouchings collect, debris, and they can have bacterial overgrowth and create micro damage, and then leakiness, which creates fever and pain and swelling and inflammation. So the antibiotics help it. I would say you got to replace what it's made of. And so we came up with it, especially people who don't feel well enough to eat fish and eggs and egg yolks and chicken with the skin on it, and meat and pork and lobster and crabs and salmon and fish and all these things. So we took the phospholipids that make this up right here. You take a scoop of this in warm water, because this is basically a bit of a fat. These are phospholipids, fat. and they mix in water better if it's warm. So that's the fat for the lining here. Okay. Now, if you take SBI Protect powder, these are the natural immunoglobulins uh, of the uh, intestinal cavity. So the cavity has in it, God has given us saliva that makes IgA immunoglobulins that fill the lining of your gut with a immune defense soldiers. And that's what this is. Plus, it has in uh, some other nutrient supportive material that is very helpful. So I mix a scoop of each of these into warm water, not hot, and I put that in the patient to drink in a cup, 2 or 3 times a day, especially if they're having acute problems with diarrhea, diverticulitis, ulcerative colitis, Crohn's, or anything like that. I often in the warm water will add in a probiotic packet, a little packet like this, that's inside this. How does this go? Like this, okay? And so I'll put that in there too. So it is the best emergency resuscitative program for any and all gut. Let me get this right here. Any and all gut problems. Orthomolecular is making these products, so it's just wonderful. Now, you have to get them through a doctor. Orthomolecular only serves physicians. So, but we have private labeled them so that we can get others who can pick it up. So, Rosa, that's the first direction I would go. And make sure you aren't trying to get junky carbs down her. If she can start taking solids, then I would give her scrambled eggs with butter and salt. And then I would give her the digestive enzymes to help her digest her food when she eats it. So that's how we would treat diverticulitis, any inflammatory bowel disorder. And that's our first steps that we do here. Christina says, hi, Dr. Rita. Sound is good here. Wonderful. Thank the Lord. We thank you, Jesus. I saw a functional doctor and she suspects I have mold toxicity. Haven't tested yet. What can I do to help clean myself out? Thank you. Fasting, a low carb diet, getting your blood sugars, starches, fruit sugars, rice, beans, crackers, these gimmick food sales that say they're low carb or keto are often very overall high. See, we trick ourselves saying, I'm eating keto, low carb, but then we eat several different keto items and it basically adds up to a higher carb diet. Then I would take, as tolerated, supplements that are known to be beneficial. N-acetylcysteine is 500 milligrams twice a day. Systemic enzymes, probably 4 or 5 on an empty stomach twice a day. And whenever you do eat, I would eat a 1 menu day so that your immune system quiets down and can focus on any aspect of mold or candida overgrowth. Make sure you get your house remediated or wherever you're working or are living so that whatever is the generation of those mold spores is being addressed. So get in a dry, no carpets, no indoor plants, no curtains. And that's pretty much how I live. I have such bad allergies. I bought my home about 6.5, 7 years ago, and I still haven't put a curtain up. I mean, people must think I'm crazy with no curtains, but I just can't handle all that allergen and stuff. So I have to try and afford maybe shades or I don't know what you call those things. What do you call those things that are the wood pieces with slats? whatever they are. I never worry about the appearance of things so much. So anyway, so that's how I would start there, Christina. Uh, Lynn says, Dr. Ellithorpe, dear Dr. Ellithorpe, thank you. I had ECG, an electrocardiogram, which came back abnormal. The cardiologist said, what do you expect with high cholesterol? Do you know a cardiologist who understands your labs and science? Yes, Dr. Um, Kelly Tucker, KELLYTUCKER. That's one of them. I know there's another functional integrative cardiologist. I just don't have his name right now. But if you call Terry, my nurse, and she will give you his referral number and location. Um, Linda, Lindy, if you are a patient here, please send me that ECG so I can take a look at it and follow up with you on that. Okay, but that's what I would suggest. Tim V says, "Hi, Dr. E. Hi, Tim, and all of you in Utah. There, what are your recommendations for a 32-year-old female with Hashimoto's hypothyroidism, partial thyroidectomy, after cancer in remission? I assume that's thyroid cancer. Medications, levothyroxine. She's overweight, borderline hypertension, and diabetes. I would recommend a carnivore diet with digestive enzyme. Get her blood type. She might need to use digestive enzyme with even meals at her young age of 32. That will provide all the phospholipids to heal up the leaky gut that created the inflammatory autoimmune that attacked the thyroid, that inflamed it, that made it overactive and then underactive, and probably created the oxidative stress for the thyroid cancer. And I would, so you're going to eat a carnivore diet so you repair the lining of your gut. And you don't eat late. You start exercising no less than 5 days a week with both weight training and aerobic training. And you should probably be on a amino acid multi-mineral like our TLC multimin. You should be on a D, probably 10,000 with K2, one a day. Then you should be on, I mentioned the enzymes like Vitalzyme or Vascuzyme on an empty stomach twice a day to disinflame. Drink half your weight in pounds as ounces of water every day. Never eat past 6 o'clock. Take iodine tablet, the iodoral, 12.5 milligram a day. I would have someone like that also use Juice Plus for its phytonutrient, antioxidant, and DNA damage reduction in its 42 plus peer-reviewed articles, including mine. I'm published on that. That's how I would begin with someone like that, Tim. And they need. We are seeing more and more wonderful young doctors, and we have our brand new doctor, Amber Majid here. She is just a extremely intelligent, well-trained internal medicine physician coming on board, who is at our clinicians meeting today. Very knowledgeable. She also was disillusioned with medicine today and how working as a hospitalist for years and years and seeing all these broken down, dear, wonderful people that have nowhere and no guidance. And not that I know everything, we know everything, but we have to, as doctors, start talking and becoming their patients, their best coach, their cheerleader toward every step they take in the right direction is going to improve and help their body. Intermittent fasting for this lady with her problem, Tim. And then I would do a 24-hour fast once a week where you don't have any food, just plenty of water and your supplements. Once a week, fasting is very healing. Dolores says, did you receive your doctor's bar? Yes, they came in, but they're the pilot ones. Dolores, we cannot sell these because when they run the pilot one, nothing's written in stone as far as their commitment to run the series for us. And then we finally get these done. And there could be a trace of nut in them or a trace of wheat or dairy. So they will not certify them or label them or sell them. So we got these bars in, and I haven't gotten mine first because I think they just came yesterday. And my intention, this is my intention, is for all of you dear souls who have waited, and if you understand that there could be a trace of dairy or nut or wheat in it, you'll probably have to sign a little paper that says, I understand these are samples and it isn't the final certified product, but I trust Dr. Ellithorpe and want to try one. So we'll give you a bunch of them. And that'll be my plan as soon as they're physically here. One of the partners, Bob Sutnary, who has been the scientist who I did the EDTA suppositories with on all the men's studies we did. And he's helped me with this and others on our team, wonderful people. And I'm waiting any day we should have a pile of them here. And we'll make a decision how we can lawfully and responsibly divvy these out, all these, the initial run. Okay. And then we need to do some taste testing, that kind of stuff. All right. Thank you for asking, Dolores. Um, shutters. Yes. Thank you, Lindy. Shutters. Yeah. Shutters are probably what I would need. Thank you. Thank you. All right. Tim says, thank you. We're all awesome. We're all doing the work of our Lord, helping one another, his dear and wonderful, great creation of humanity. Tim, thank you. God bless you. Lisa says, hi, Dr. Ellithorpe. I wanted to compliment you on PA Gonzalez. Thank you so much. Saw her for the first time last month. She is very sweet and attentive. Also made a follow-up phone call in a week to go over that test results. Lisa, thank you so much. And I will tell PA Gonzalez, I was in the military and all physician assistants were called doctor. So I call Dr. Gonzalez, but technically she's a physician assistant with the extra training in urology. So she's absolutely a blessing to me, just like Dr. Gonzalez. Dr. Majid is, but Dr. Merrick, Dr. Mitchell, Dr. Kaur, Dr. Patel, PA Patel, Dr. Johnson, all these people are God's creation. And they're all very good. They're all people who want to serve and continue to learn. So I'm so blessed to have them. Thank you for your compliment, and I will pass it on. Gotcha. I will call her that too, Dr. Gonzalez. Yeah, yeah. And Dolores says, do you know anything about CofixRX Iodine nasal spray? I think that came up because the nasal iodine wash for this alleged COVID pandemic iodine was used. Let me write that down. CofixRX Iodine. That is a weak, my understanding, if I'm thinking of the right thing, it's a very dilute iodine that you inhale in each nostril. I haven't done it. I use Argentin because the same thing happens and protection happens with Argentin silver. Elabosa says, I read that hops contain 8-phenylarginine and is one of the best estrogen boosters. I'm going to have to look that up. 8-phenylarginine estradiol booster. All right, so Ablosa, I'm going to have to check that. In the very distant, remote brain cells of this old 70-year-old woman, that seems to be correct. Is this true? Should I switch drinking wine and buy some beer instead. No, no, because I don't like any alcohol. Alcohol is a toxin, and I don't want to raise estradiol in a false way. So I would not do that. So anyway, I have to look up 8 phenylalanine arginine. Okay, I'm going to look that up and come back next week. I will not forget this one because this is the kind of stuff that makes me excited. Okay, now let's go back to our questions here. Christine says, I have SIBO, small intestine bacterial overgrowth, and I'm taking Xifaxan, that's an antibiotic. Simultaneously, I've been prescribed a medication for heart failure that has side effects to potentially cause urinary tract infections and yeast infections. My urologist and gynecologist have recommended a pre and probiotic and D-mannose. Good, that's good for them. Am I correct that a prebiotic is not advisable to take when you have small intestine bowel obstruction? Well, many foods essentially become a prebiotic. Artichoke, inulin. I'd have to look up the list myself, but you can't live life in fear of these healthy nutraceuticals like pre and probiotics with D-mannose. That's a very small thing compared to the volume of food you're eating. I would be far more concerned about feeding small intestine bacterial overgrowth with too many carbs, starch, fruit sugars, and things like that create an imbalance of the bad bacteria. So that's how I would look at that, Christine. Okay. Pat says, hi, Dr. Rita. I'm 69 years old and received the first and second Moderna COVID vaccines when they were being highly recommended for older people with underlying conditions. I have cardio and endocrine issues. I also received the COVID booster in early 2022 in order to travel abroad. Is there any way to detox these poisons I allowed to be put into my body? Pat, yes. And we have, and I'm glad to see that doctors like Dr. What is his name? Well, I am having an age-related brain fart right now. McConnell, and the other one is Malone, and who else? Dr. I haven't used his name in a long time. The one who promoted ivermectin. But anyway, I'm glad these doctors are starting to learn functional medicine. But right from the beginning, I was giving broadcasts in January of 2000, and where I'm telling you about the antiviral aspects of high-dose vitamin C, the importance of microcirculation, adequate hydration, vitamin D, the mineral zinc, and the anti-inflammatory effect of systemic enzymes. Now, EDTA is able because it is a anion, and the spike protein happens to be an anion, and all toxic metals, the spike protein happens to be a cation, positive, and all heavy metals that are toxic are cations, positive. So EDTA has improved the microcirculation to help prevent clotting. It helps platelet from being sticky. So it's a calming modality, medical medicine, ethylene diamine tetracetic acid, calcium disodium. These are all anti-coagulating, nitric oxide synthetase enhancing for vascular vasodilation of the microcirculation. And the fluid, the vitamin C, the zinc and minerals, rehabbing chelation, all these wonderful things help to reduce spike, build the immune system so that the T cell function that was harmed by these spike proteins can hopefully and apparently seem to improve, because all of our patients, even those who did take the mRNA injections, not one of them have we lost, not one of them have we had any serious long-term effect. And they do the EDTA chelation, they do the enzymes, they do the low carb, they drink the water, and they're walking and moving. So the good news is, Pat, yes, all these things can help to reduce it. Plus, I would stay on quercetin, 600 milligrams a day minimum every day. You could take preventatively ivermectin twice a week, so that no secondary viral illness can take over you with any potential weakening of your T cell function that has been reported in several peer-reviewed literature pieces regarding that potential harm it may have brought. John says, my ureter is partially pinched and my left kidney is always swollen. Is there a natural way to heal my ureter so it is fully open? John, this is now structurally an issue. Usually prostate swelling pinches the ureter and puts pressure on it. And so you need to see a urologist. They can put a stent in there, which will enhance the urine flow. That's like a little soft plastic tubing pipe, but you have to see a specialist in that. You could come by if you're a patient here and see PA Gonzalez. She's excellent in the urological advice and training and years of experience. But all the things that enhance every single cell function in your human body, disinflaming you, drinking healthy volumes of water, vasodilation to help move debris, inflammatory protein waste breakdown products, stop the sticky sugar, sticky complexes that clog up the capillaries, stop eating wild variety of food, eat a simple one menu day so that the lining of your gut can help fix with phospholipids and proteins the healthy single membrane of your cells in your colon. All these things then work together. Plus, we know that EDTA chelation with nephrology research studies on chronic kidney disease improves creatinine and glomerular function. So get a good functional doctor. If you're in the area, come see us. Come see PA Gonzalez, urologist, PA, and get your specialists to potentially determine if you need any specialty support like a stent. Brenda says, recommendations to help improve a subclinical low thyroid with adrenal fatigue, menopause. That's about every woman in America, Brenda, trying to improve energy levels and feel more alive. The thyroid labs are slightly off. Adrenals have shown low cortisol, but I believe this is from prolonged stress over time. Well, here's an area where you need DHEA, 25 to 50 milligrams a day. I can turn around a cortisol in a couple of months with DHEA supplementation. I have taken thyroid and adrenal supports for some time, but slow improvements. Brenda, I don't know who you are, but almost all women and young women moving toward this as they move toward menopause and aging and toward our day of death. This is something that everything I've told you applies. I just have to see who you are, where your fasting insulin, your triglycerides, your HDL, your hemoglobin A1C, your insulin levels are. I need to get your, body mass, your body makeup. I need to see your inflammatory markers. I need to get a feel for your blood type and your digestion and your exposure and age and life to damages, and put all these things together and a pathway toward healing. See, God wrote the message in Psalm 139. He wrote about, written in the book are my members as before they were even formed. And God's talking about the instruction book of his DNA writing the intelligent language of the DNA, and that's why evolution has been proven wrong. And so, in that DNA is the healing for every cell in every part of a human body. What we have to get out of the way is our bad habits, our lack of water, our inactive bodies, our poor sleep habits, our clogging up sugars and starches and fruit sugars, our late night eating, our alcohol consumption, cigarette smoking, all these kind of things. We have to get ourselves out of the way. And, so much like the gospel, uh, die to yourself and live. So the world's marketing is to have some oral excitement every time you put something in your mouth. God never meant for this to be an excitement center. This was a method to use our mouth to bring love and honor and instruction and encouragement to our family, friends, and neighbors, to all mankind. It was never meant to be some entertainment hole. And so, Brenda, I would just say follow these good functional doctor. Try and work on this and see the best we can do for you. Brenda also goes on and says, my friend has alopecia, hair loss. Her hair has grown back a few times, but then she loses it again. Her blood tests have shown no issues overall. Thoughts on how to help her grow her hair back? Again, remember, hair is made of protein, and this is a non-essential part of our body, the protein here, but it is in our bones. And when there's stress, aging, breakdown, and as our capillaries to our scalp and stuff diminish, then your body is going to take what protein you do get in, because they're trying to tell you not to eat meat now. It used to be eggs and stuff. Now they're down to saying meat is bad. We're living in upside down world. Anyway, we have to see how good her gut is, because if she's not absorbing it and your body senses lack of it, it's not going to put it in her hair. So whoever this is, we have to do a complete digestive stool, and we have to get her thyroid antibodies and her hormones, that kind of stuff, and probably find out her heavy metals levels and that kind of stuff. Barbara says, is the Prevnar 20 vaccine safe? I'm not familiar with it. And is it necessary to do? Do you know of any long-term side effects? Want and asking for a friend who is healthy, active, 70-year-old. She had fatigue and muscle pain, but it lasted more than a month. She has her first appointment with TLC this month with Dr. Gonzalez. Well, she'll be blessed here. Let me write down the name of that vaccine. Prevnar 20 vaccine. What is it? All right, so that's new. So, the way old doctors can stay current is to talk with their patients and get questions like this. And then we can continue to learn as doctors and take all of our experience and mix it with the new, and hopefully the best results for our patients. Let's see, anyone else here? Pamela says, Dr. Robert McCullough. Yes, that was the one. Yeah. Thank you, Pamela. He's one of the doctors who was talking about working a way to deal with the toxicities. So I'm glad he figured it out finally. So praise the Lord. And I'm glad to see these doctors learning to grow and develop. Susan says, hi, Dr. Ellithorpe. I have lupus and recently diagnosed with Sjogren's. So that's an autoimmune. It starts in your gut. You got to have a complete digestive stool analysis. We have to look at your sugar levels. We have to look at your blood type, your digestive capacity, your hormone levels. I've been working on my healing gut with glutagenics. That's a good first step. SBI Protect, good. Systemic enzymes and probiotics. Any recommendations? I would go carnivore, Suzanne. Basically, eating meat, a carnivore diet supplies a plenteous, massive repair system for the entire 40-foot tube, so that it will quiet down the immune system, inflammation, all these autoimmune phenomena. I've seen it over and over and over and over again. That's my general first knee-jerk reaction, and that's why we use these things. This phospholipids is what you get when you eat the meat to plug these holes up again. The protein and the immunoglobulins are here, and then the probiotics up here. So that's how I would look at that, Suzanne. Pamela says, I have left lower lung atelectasis. When I swim, I get winded. What can improve my lung function and increase nitric oxide? Thank you, doctor. Well, I would do EDTA chelation therapy, hands down. I would take systemic enzymes on an empty stomach twice a day. I would drink half my weight in water. I would eat a robust, healthy, simple one menu day, rich in proteins and iodine and N-acetylcysteine and the antioxidant protection from Juice Plus. I would do all those things, maybe more. I don't know if you are. There might be something else. But long and short is atelectasis is just little sacs that kind of get stuck together from not expanding your lung enough. And they have these little clacking, it's like little popping sounds when I'm listening in on it's a little crackle. And as I hear these little smacking sounds, I have the person take another deep breath, cough, or take a second deep breath, and then it opens it up. And sometimes I make the patient, most people are sitting kind of humped over like this. And then I say, sit your chest up. Nice. That's why I want you to do weight training. And that's what I'm going to do here in a minute. So this is 7:01. I've got to go with my husband and get some weight training in and work out with him, and then get home by 8 and get some sleep. The Lord bless you and keep you and make his face to shine upon you. Please treat your neighbor with love and respect. And there's so much healing in reaching out to another person with words of encouragement. Truth, not to deny sin, not calling sin out, as it would be wrong too, but please love one another. This world needs the loving, God-fearing person to be bold for God and his kingdom, and for reaching out to so many people who need it. Well, the Lord bless you. TLC loves you. Our team is here and ready to take care of you. And I think I have the best team and the best doctors. And so I give thanks to God Almighty and my Lord and Savior, Jesus Christ. All right. See you next week. Bye-bye.